Brachial plexus. The plexus consists of roots, trunks, divisions, cords. Roots. These are constituted by the anterior primary rami of spinal nerves C5, C8 and T1, with occasional contributions from the anterior primary rami of C4, and the origin of the plexus may shift by one segment either upward or downward, resulting in a prefixed or postfixed plexus, respectively. In a prefixed plexus, the contribution by C4 is large and C5 is present, T1 is small, from T2 is often absent. Large, T2 is always present, C4 is absent, and C5 is reduced in size. The roots join to form trunks as follows. Brachial plexus and branches, figure 4.14. T2, figure 4.8. In a postfixed plexus, the contribution by T1 is roots and trunks. Supraclavicular part. Root C5 and C6 join to form the upper trunk. Root C7 forms the middle trunk. Root C8 and T1 join to form the lower trunk. These lie in the neck between scalenus sheath from prevertebral fascia, see figure 12.10. Each trunk, 3 in number, divides into ventral and dorsal divisions, which ultimately supply the anterior and posterior aspects of the limb. These divisions join to form cords. I. The lateral cord is formed by the union of ventral divisions of the upper and middle trunks, 2 divisions. E. The medial cord is formed by the ventral division of the lower trunk, 1 division. E. The posterior cord is formed by union of the dorsal divisions of all the 3 trunks, 3 divisions. These are named according to relation of cords to anterior and scalenus medius muscles, carrying axillary divisions of the trunk's retroclavicular part. Cords and branches. Infraclavicular part. The second part of axillary artery. Branches. The roots value of each branch is given in brackets. Branches of the roots. The roots value of each branch is given in brackets. The key muscles, for overhead abduction. This nerve supplies rhomboid minor and rhomboid major muscles, responsible for retraction of the 3 and branch to phrenic nerve, C4. The root of phrenic nerve from C5 is small 1, the main root is from C4. Phrenic nerve is the sole motor nerve supply of pericardium and part of the parietal peritoneum. Branches of the trunks. These arise only from the upper trunk, which gives 2 branches, one suprascapular, C5, C6. This nerve supplies 2 nerve to subclavius, C5, C6. It supplies the small subclavius muscles. It may give a root for phrenic nerve. Branches of the cords. Branches of lateral cord 1 lateral pectoral, C5, C7. This nerve supplies both 2 musculocutaneous, C5, C7. This is the nerve of long and short heads of biceps brachii and the brachialis muscles. 3 lateral root of median, C5, C7. It joins the medial root of median nerve. Median nerve is the chief nerve of the muscles of front of forearm and of muscles of branches of medial cord 1 medial pectoral, C8, T1. It also supplies both the 2 medial cutaneous nerve of arm, C8, T1, carries sensory impulses from a small area of medial side of arm. 3 medial cutaneous nerve of forearm, C8, T1, carries sensory impulses from large area of medial side of the forearm. 4 ulnar, C7, C8, T1. C7 fibers reach by a communicating branch from lateral root of median nerve. 1 nerve to serratus anterior, long thoracic nerve, C5, C7. It only supplies serratus anterior muscle, 1 of 2 nerve to rhomboids, dorsal scapular nerve, C5. Shoulder girdle gives a branch to levator scapulae. Branches to longus colli and scaleni muscles, C5, C8, thoracoabdominal diaphragm. In addition, it carries afferent fibers from mediastinal pleura, fibers supraspinatus and infraspinatus muscles. Pectorals major and pectoralis minor muscles. Muscles of front of arm, i.e. coracobrachialis, both the thenar eminence. Pectoralis minor and pectorals major muscles. Branches of posterior cord 2 nerve to latissimus dorsi, C6, C8. Only supplies nerve. 3 lower subscapular, C5, C6. It helps upper muscles. In addition, it supplies the teres major muscle. 4 supplying one of the important muscles of the shoulder, the deltoid. It also supplies small teres minor muscle. 5 radial, C5, C8, T1. This is the thickest branch of brachial plexus. It supplies all the 3 heads of triceps brachii muscle. Then it supplies 12 muscles on the back of forearm. In addition to the branches of the brachial plexus, the upper limb is also supplied, near the trunk, by the nerve. Sympathetic nerves are distributed through the brachial plexus. The arrangement of the various nerves in the axilla was studied with the relations of the special features. The lateral cord, medial cord and their branches form the letter M, with the 3 corners extended and lateral root of median. Medial cord gives ulnar and medial root of median. The lateral and medial roots of median nerve join to form the median nerve. Arteries supply blood to the brachial plexus. These are the lifeline of this important plexus. 1 upper subscapular, C5, C6. This nerve supplies large multipennate subscapularis muscles. Muscles of its name. It is also called thoracodorsal subscapular nerve in supplying of the subscapularis axillary, circumflex, C5, C6. It is responsible for supraclavicular branches of the cervical plexus, and by the intercostobrachial branch of the second intercostal axillary artery. Figure 4.8 inset. Lateral cord gives musculocutaneous blood supply of brachial plexus vertebral artery and thyrocervical trunk with its branches, the suprascapular and transverse cervical. Site of injury. 1 region of the upper trunk of the nerves meet here. Injury to the upper trunk causes of injury, undue separation of the head from the shoulder, which is commonly encountered in the following. I. Birth injury, difficult childbirth. Nerve roots involved, mainly C5 and partly C6. Deformity and position of the limb, medially rotated. Forearm, extended and pronated. The deformity is known as policeman's tip hand, or waiter's tip hand or porter's tip hand, figure 4.16. Disability. The following movements are lost. Mbbs paralysis. Brachial plexus is called Mbbs point, figure 4.15. 6 Mbbs paralysis. E. Fall on the shoulder. E. During anesthesia, muscles paralyzed, mainly biceps brachii, deltoid, brachialis and brachioradialis. Partly supraspinatus, infraspinatus and supinator. Arm. Hangs by the side, it is adducted in. Abduction and lateral rotation of the arm at shoulder joint. Flexion and supination of the forearm. Biceps and supinator jerks are lost. Sensations are lost over a small area over the lower part of the deltoid. Site of injury, lower trunk of the brachial plexus. Cause of injury, undue abduction of the arm, as in clutching something with the hands after a fall from a height, or sometimes in birth injury. Muscles paralyzed, intrinsic muscles of the hand, T1. Deformity and position of the hand. Claw hand due to the unopposed action of the long flexors and extensors of the fingers. In a claw hand, there is hyperextension disability, zone along the ulnar border of the forearm and hand. Klumpke's paralysis nerve roots involved, mainly T1 and partly C8. Ulnar flexors of the wrist and fingers, C8. At the metacarpophalangeal joints and flexion at the interphalangeal joints. Complete claw hand, figure 4.17. Cutaneous anesthesia and analgesia in a narrow. Horner syndrome, if T1 is injured proximal to white ramus communicans to first thoracic sympathetic be associated. This is because of injury to the spinal cord through nerve T1, figure 4.18. Is warmer due to arteriolar dilation. It is also drier due to the absence of sweating as there is loss of sympathetic activity. Leads to dry and scaly skin. The nails crack easily with atrophy of the pulp of fingers. Causes, 1. Sudden pressure on the shoulder from above. 2. Carrying heavy loads on the shoulder. Deformity, winging of the scapula, i.e. excessive prominence of the medial border of the scapula. Normally, the pull of the muscle keeps the medial border against the thoracic wall. Disability, loss of pushing and punching actions. During attempts at pushing, there occurs winging of the overhead abduction of shoulder girdle as partly affected due to intact trapezius musicae. Ganglion, there is PTOSIS, meiosis, anhydrosis, enophthalmos, and loss of ciliospinal reflex may sympathetic fibers to the head and neck that leave vasomotor changes. The skin area with sensory loss trophic changes. Long-standing case of paralysis injury to the nerve to serratus anterior, nerve of Bell, scapula.